Hello everyone, welcome to this educational presentation on diabetes type 1. According to the Diabetics Care Program of Nova Scotia, approximately 1 out of every 10 or 77,000 adults are living with diabetes. The highest rates are in Cape Breton and the South Shore, with prevalence increasing to about 25% over the past 5 years in Nova Scotia, with over 6,100 new cases diagnosed each year. Since this is a large portion of Nova Scotia's population, I thought this would be a great topic for client education and focusing specifically on type 1. So what is type 1 diabetes? Type 1 diabetes is a lifelong endocrine condition. It is a disease of the pancreas where the body's insulin-producing cells, beta cells, are damaged. The pancreas cannot produce much of its own insulin, or none at all. Insulin is a hormone that assists our bodies to control our sugar or glucose levels in our blood. If sugar cannot get into our blood cells for our bodies to use as energy, it causes our blood sugar levels to rise, because the sugars or glucose is building up within the blood instead of being used. Type 1 diabetes is not caused by eating too much sugar, and type 1 is not preventable. It is thought that there is a correlation between the body's immune system damaging the insulin-producing beta cells. The damage to these cells can take place over years, but symptoms of type 1 could occur within a time frame of a few days to a few weeks. People experiencing diabetes have greater risk of comorbidities and medical complications, and this is most significant in the youngest age groups. In saying so, type 1 is the most prevalent form of diabetes in people younger than 20 years old, although it can occur at any age. Therefore, it's sometimes called juvenile diabetes. What are our signs and symptoms of type 1 diabetes? Well, one of the signs we hear the most often is an increase in thirst and a dry mouth. And another common heard symptom is frequent urination. So if you have kids who are always running to the drinking fountain at school and to the bathroom, and they also exhibit some of these other symptoms, it's a good idea to set up an appointment with the family doctor. Also, an increase in appetite, especially or even after eating a meal. Weight loss with a healthy appetite and hunger present. A weakness and feelings of tiredness. Blurry vision. Any numbness or tingling in the hands and feet. Slow healing wounds, so if cuts or sores are slow to heal. Dry and itchy skin, especially in the vaginal or groin areas, and frequent yeast infections. Diagnosis for type 1 diabetes. Testing and diagnosis for type 1 diabetes are as follows. Your doctor can do a number of different tests. The first one is a fasting blood sugar test. This is where a blood sample is taken and tested after a period of fasting. That is, after a period with no food or drink by mouth. The blood sugar values given are in milligrams per deciliter. So a normal blood sugar presents as 100 milligrams per deciliter. 100 to 125 milligrams per deciliter would indicate pre-diabetic. And 126 milligrams per deciliter or higher confirms diabetes as present. The next test that your doctor can do is called an A1C blood test, a glycated hemoglobin test. It will indicate what your blood sugar level is for the past 2 to 3 months. It measures the amount or percentage of blood sugar attached to the hemoglobin. The higher your blood sugar level, the more hemoglobin you have with sugar attached. So if the percentage of sugar in hemoglobin is less than 5.6%, that is normal. A 5.7 to 6.4% indicates pre-diabetic. And having 2 separate tests 2 separate days in a row showing 6.5% or higher, you have diabetes. Some conditions make an A1C inaccurate, such as being pregnant or having an uncommon form of hemoglobin. So in this case, your physician might need to use the fasting blood test, or there is also a random blood sugar test. In a random blood test, a blood sample can be taken at any time, regardless of when you have eaten last. So a normal would present as 140 milligrams per deciliter. Anything from 140 to 199 indicates pre-diabetic. And levels of 200 milligrams per deciliter indicates diabetic, especially when any of the signs and symptoms accompanying these levels are present. What happens after diagnosis and treatment? Treatment plan after diagnosis will include insulin therapy, and you will need to regularly visit your physician to monitor your blood sugar levels. This will probably be done in the form of A1C tests. They are a better indicator than daily blood sugar tests of how treatment plans are working. So until your A1C goals are met and stabilized, you will probably have a visit every 3 months, and then twice a year for those who are meeting goals and confidently managing their treatment. Target goals, according to the American medical recommendations, are kept at or below a 17 milligrams per deciliter. Your doctor will also take periodic urine samples and do regular blood pressure tests. They will also monitor the injection sites to check where your insulin is delivered. These visits will help assist in managing how many insulin injections are needed daily, how to time them, and what dosage is needed. And will also include setting you up with a dietitian to make a meal plan. How can you manage type 1 diabetes? You can control diabetes with a healthy lifestyle, proper nutrition, and support. As discussed, your treatment plan will consist of a meal plan. This will include all food groups to achieve a balanced diet with healthy meals and snacks while following Canada's Food Guide, and an exercise plan built to meet your lifestyle needs and goals. Exercise can improve the body's sensitivity to insulin and helps manage blood glucose. When you exercise, muscles that are active are using glucose as energy, which prevents the sugar or glucose from being stored in your blood. A recommendation of at least 150 minutes of aerobic activity weekly is given. Now let's look at a couple of the short-term complications that can present with a diabetes diagnosis. There are a couple of things to watch for in managing blood sugar levels. We want to make sure blood sugar levels don't plummet too low. This is called hypoglycemia, and would show as blood sugar below 72 milligrams per deciliter. The three main symptoms are sweating, fatigue, and dizziness, and other lesser symptoms would be paleness, weakness, being hungry, having a high heart rate, blurry vision, confusion, convulsions, loss of consciousness, or in extreme cases, a coma. These can be caused by taking high doses of insulin, delaying meals, taking alcohol in adults, or can be expected after prolonged periods of exercise because the muscles are using up the body's blood sugar for energy. There may be little to no warning signs, especially if sugars are low after waking in the morning after a night of fasting or sleeping. Mild hypoglycemia can be treated by eating or drinking 15 to 20 grams of carbs that act fast, like fizzy drinks, 7-Up or colas, fruit juices, sweets or glucose tablets, or a slower acting carbohydrate if the next meal isn't due. You could wait 15 to 20 minutes and check your blood sugar again to make sure the levels have recovered or stabilized. You want to check your blood glucose levels before activities, and remember to take a juice box or snack in case you need to quickly raise your blood sugar levels. Have a pre-exercise snack if levels are less than 100 milligrams per deciliter before a workout. Or you might need to lower your insulin levels before activity. And in extreme cases or emergencies, if a loss of consciousness or seizures occur that last longer than 5 minutes, call an ambulance. Blood glucose levels can also run high. This is hyperglycemia. It mostly affects type 2 diabetics, which we're not touching on, but it can affect type 1 diabetes as well. Some causes are high-intensity exercise, because this increases the stress hormone that raises the glucose hormone. Periods of illness, especially if medication is not sufficient to lower the glucose levels, or having a blood glucose level of 600 milligrams per deciliter for an extended period of time. When someone with diabetes gets into a hyperglycemic state, elevated blood sugars lead to excess sugar being excreted in the urine, which leads to frequent urination and dehydration can occur. Some other signs and symptoms are dry mouth, extreme thirst, warm skin with no sweat, fevers, convulsions or hallucinations, feelings of tired or sleepiness, vision loss, nausea, or weakness on one side of the body. If your blood sugar is running high before starting an activity or during the activity, check your urine for high ketones. If you test for ketones, avoid the activity, drink liquids, and check your blood sugar levels to monitor the changes and make sure they return to normal levels. In an emergency, call an ambulance, and they will administer fluid and electrolytes replacement or insulin therapy. Now it's time to take charge of your diabetes. For people and children with type 1 diabetes, daily life and routines can be complicated after being newly diagnosed. It's important for the diabetic person to be comfortable treating their illness. As the Canadian Diabetes Association says, you are the most important member of your healthcare team. Only you know how you feel and what plans work best for you and your lifestyle. So work with your doctor to get comfortable and find out how often and what tools work best for you in testing and keeping a blood sugar log. Keep and stay prepared. Anticipate highs and lows and have the essentials on hand to get you through. It could include having to change your diet and exercise programs every so often, but set your goals and keep track. And share your goals. Help everyone close to you stay involved so that everyone can help and support you and stay on track with what you're doing and why you're doing it. Check out the following online resources for support programs and even kids' summer camps available in your area throughout the province. Your health is in your hands. You can do it. Thanks for watching.